Seemant Chaturvedi. I'm the Stuart Greenbaum Endowed Professor of Stroke Neurology and the Stroke Division Director at the University of Maryland School of Medicine and Medical Center. I see a lot of patients who've had a stroke or are at risk for stroke, and that includes patients with narrowing in their arteries leading to the brain, or patients with atrial fibrillation or other types of heart conditions. And then I also see patients with cognitive impairment, and then some with general neurology conditions such as seizures or other ailments. I think it's important to have sort of a holistic approach to the patient and consider like what was their background, what is the reason that they're coming to you, and then what are sort of their hopes and goals for the future. And especially if they've had an event such as a stroke, to understand what their aspirations are for recovery and to help them along with resources for recovery. And it's also important to look at the patient's level of social support, because we know that's very important in recovering from any illness. And so I try to have some assessment of their social support. And then in terms of, we know that some neurologic conditions can affect cognition. And so it's important to assess their cognitive abilities and see whether they have any evidence of cognitive impairment, and then what are some of the strategies which can be done to help deal with those impairments. Yeah, I'm a big sports fan, and so I'm especially a follower of tennis and baseball and football. And I try to play a little tennis myself if my knees cooperate, and then I try to have other forms of regular exercise. And also I enjoy world travel, and so I think I've been to at least 20 countries, hopefully trying to work on increasing that list in the coming years. One of the things I really enjoy is the ability to do clinical research and try to improve the field of stroke prevention and stroke treatment. We know that at our University of Maryland Medical System, we care for over 2,000 patients a year with stroke. And so we know that it's a huge public health problem, and one which is going to be even more important with the aging of the population. And so clinical research to address the prevention and treatment of stroke and recovery is essential. And so one of the ways we do this is through clinical trials. And so I enjoy being able to offer the clinical trials to patients and seeing if they can sort of participate in cutting edge medical treatment. And then also just treating patients on a daily basis and trying to get them back to their previous level of functioning, or at least help them with optimize their function. That is probably one of the most gratifying things.